Have you ever started a psychiatric medication and notice within few days or even within few doses that you start having or your patient having dry mouth and start having problems with eating, the appetite has been affected, and the person who's taking the medication is not happy being on medication. They're drinking a lot of water, but still the dry mouth is not going away. So what's the reason behind it? What's the cause behind it? How can we manage that side effect that can cause a person to stop taking the medication because of this side effect? And it is very common also. So let's talk about it in this video. So what is the reason behind the dry mouth? Medications can affect the muscarinic receptors. So acetylcholine usually works on the muscarinic receptors and cause the saliva to come. And the importance of saliva is that it not only helps us with eating, it also causes to have a better flavor in our mouth. When we don't have saliva, we have dry mouth, we have hard time chewing the food, and also have hard time swallowing the food. The food does not taste good. And not only that, less saliva in our mouth can also cause us to be prone for having infection of the gums of the mouth. So it's not only when someone is complaining about dry mouth, it's only that it's uncomfortable. It's also have a lot of damaging effect on a person. A person appetite can go down also, so that can affect them. A person can have bacterial or fungal infection in their mouth also. So it can be a dangerous thing also if it lasts for a longer time. So when these medication acts on or blocking the muscarinic receptors, that's where the dry mouth comes. So what medication cause that? A lot of medication can cause it. What I tell myself when I'm prescribing the medication, that any psychiatric medication I am prescribing can cause dry mouth. So whenever I'm starting someone on any medication, I usually ask them about side effects, especially if they have the dry mouth, because it's very common. Some of the medications are being said that they can almost 25% or sometimes 20% of the population can have dry mouth. Dry mouth can go away, but sometimes it persists. So what medication class? I will say most of the antidepressant can cause a dry mouth. So when it comes to, let's say, SSRIs, like Prozac, Paxil, Zoloft, Celexa, Lexapro. Out of all these SSRI class, I believe Paxil is more notorious to cause more dry mouth, but any SSRIs can cause it. Even SNRIs like Effexor, Cymbalta, then they can also cause that. When it comes to antipsychotic medication, most of the antipsychotic can cause dry mouth. I would say the older ones are more notorious for that, like Haldols, Thorazine, Perfenazine, Flufenazine, but the newer one can also cause that. Interesting thing that the medication clozapine usually cause increased salivation. So when we are prescribing clozapine, sometimes we feel that, oh, it's not going to cause dry mouth, but a lot of people during the daytime, it can cause dry mouth also. So when you are prescribing clozapine, make sure talk to the patient about if they have dry mouth in the daytime and even cyalorrhea or what we call excessive drooling or excessive salivation at night time. Even mood stabilizers can also cause side effects of dry mouth. But when you are prescribing lithium, make sure when someone is complaining about dry mouth, you also ask them about increased thirst. If they are having increased thirst, if they're drinking a lot of water, make sure to check their kidney levels. Maybe the kidney levels might be elevated. That's why they are drinking a lot of water. So when someone is saying that, oh, I'm drinking more water, does not necessarily mean that they are drinking water because of the dry mouth. They can have some other side effects also. So when someone is complaining about dry mouth, does not necessarily means by itself that it's the medication side effect. So if you have started the medications, ask for the dry mouth, but also keep thinking about, are there anything else going on? Let's say if they are on some other medications that can cause dry mouth, or if they have sleep apnea that can exacerbate the dry mouth, or if they are not drinking enough water, that can cause. If they have any thyroid condition, that can cause. If they have any other mouth infections going on, that can cause that. So think about any other reasons that can cause dry mouth. So I usually also check the CBC, CMP, thyroid level, kidney function test also. So you can check that just to make sure the labs are within normal range, they don't have any infection going on, or if they are on some other medications that are already causing dry mouth, adding a psychiatric medication can further exacerbate it. Are there any interaction going on between the medications that are causing increased dry mouth also? So when you find out what is the reason, it's not infection, it's not the person is not drinking enough water, they don't have any other medical reasons going on, or they are not on a lot of other medications that causing these kind of side effects. So once you have a clear idea what is causing dry mouth, so then you can have the systematic approach. The first approach is, let's say if it's the medication that is causing dry mouth, can I cut down the dose of the medication? If I can I split the dose of the medications? Sometimes people take medications at night time and feel that, oh, my dry mouth is a little less. Can you switch the medication to a different medication that does not cause that much dry mouth? But if you cannot do either of those, or if you have tried all these and if still a person is having dry mouth, then I would recommend that make sure the person is drinking water frequently or having ice chips frequently. They can also have some chewing gum that have xylitol in it, so that does help with that. Also, there are sprays in the market that can help increase the saliva secretion and decrease the dry mouth also. And also, you have to make sure that the person is not drinking a lot of acidic things, also not consuming a lot of caffeine, not smoking a lot of cigarettes. So that can also be helpful in decreasing these kind of symptoms. Sometimes the mouthwash also, like biotin mouthwash, is also very helpful. So you can try all these techniques, but make sure the person does not drink a lot of sugary drinks, because that can exacerbate the dry mouth. Not to have a lot of candies, and not to have a lot of like orange juice or lemon juice, because they can be acidic and sweet, so that can also exacerbate the dry mouth. So in short, make sure that you keep an eye on this side effect of dry mouth, because it's very common and a lot of people can stop taking the medication even if the medications are working, but it's such a painful kind of side effects, and if it does not go away, then it's difficult to continue the medication even on for medication that has been effective for the person, depression, anxiety, bipolar or psychosis, but then it's difficult to carry on like this. So discuss with the patient, ask the patient, even if they are not talking to you about it, discuss with the patient, see what can you do to help them with these side effects. So I hope this video was helpful. Let me know if you would like me to make some other content. Thank you very much for watching.